when we are probing, we're going to be working on page 2 of our oral assessment form. And so we would have charted, right? And then after we've charted, we're going to probe. And why would we want to chart before we probe? What would be a simple reason?
So we don't stick in any caries or
Or whether
No,
Mrs.
you
T.
wouldn't do that
restoration?
anyway. No. What about bleeding? You think they might bleed?
Mm-hmm. Yeah.
It might.
Affect your chart.
Yeah. Well, it might affect your probing. Okay, so, or your charting. So we're going to chart first, and then we're going to probe. So, remember we talked about in class yesterday that we're going to mark on our chart when we're doing it on our oral assessment any readings that are 4 and greater, right?
Mm-hmm.
Okay. And we mentioned that we mark 3 areas buccal and 3 areas lingual, right? Okay, so that's what we're going to do. Now, I would get used to knowing where your teeth are on your chart and where they are in the mouth, and make mental notes of where you find things so that you're not, oh, I found a 4, let me go write it down. Okay? Kind of keep in your mind where you're finding things, and do groups of teeth and then write. Okay? So, turn this way. Let's look at some anatomy that we talked about yesterday. Do you think, Ms. Hoffman, do you think those intraoral cameras would show?
They probably wouldn't show as well because they've been real blurry.
Is it because of
That's because of the sleeves that we have
we need
there.
the Action sleeves, and they come with them.
Mhm.
The Action sleeves come with them.
You wanna
So
try it?
we may have it. You think it'll show the video? Can you
If they could all see, I don't know, we can try it.
Well, let's see how we do first.
All right.
Light's affecting me over here. I'm sorry.
Okay, so we would have looked in and looked around, okay? And so remember yesterday we talked about some anatomical features of the gingiva, right? Okay, so this line right there was the free gingival margin, correct? And if you look real closely, she's got a nice little indentation or groove right there. Do you see it? Okay, and what was that called? Free gingival groove. All right, and the free gingival groove is an indication of what?
Where the gingiva attachment to the, yeah.
And what's it called?
The
Junctional epithelium. So it's an indication of where the junctional epithelium is. Okay, so then we have that, and then do you see the nice pink stipple? See the orange peely? Okay, so that is the attached gingiva. And then if I pull this up, do you see a dark line of demarcation right there where it's a little bit more purpley and it's movable? Okay, so that dark line is the mucogingival junction, and then anything that's apical to that is the alveolar mucosa. And then up in here is the vestibule, and then here we have the labial mucosa. See that? Inside of the lip. All right, same thing on the lower. All right, so if I put my probe in, it stops. You can see it. It stops right there at where that indentation or that free gingival groove was. Okay? And so I know about where it's supposed to stop because I can see that groove. All right? Okay? And so I am probing into the sulcus, and what I've done is I've taken the nib, which is the end, gone down along the tooth, worked it under the gingiva until it stops, and it feels like when you push on your skin. That's what it feels like. Okay, it doesn't feel like a rock. Okay, if it feels hard, then what we're feeling is calculus, right? All right, so then we want to go around it. Now, when we're probing, we're going to begin on one side of the arch and work across to the other side. We're not going to work in areas 1, 2, 3, 4, 5, 6 like we did for scaling. All right, and I have my own way of probing, so you're going to figure out which way you like to do it. Okay, so what I do, I start on the lingual on the right, and I work across to the lingual of the left, and then I come back and I do here, and then I drop down and I do the linguals of the lower, and then I finish up on the buccal. That's me. There's no wrong way. You just have to make sure whatever way you do it the same way every time. Does everybody understand that?
If I can add something,
Mm-hmm.
that would be the software that you're now using is usually going from the buccal of the upper right arch, so tooth number 1 or 2, all the way up to 16. Then the lingual, go all the way across back to number 2, okay? And then it goes to the buccal of tooth number 31 or 32, and all the way across to
So you need to know where
17.
you are in whatever software you're using. You have to know where you are in the mouth. Okay, so in order to get in this most posterior, I'm going to take my mirror and I'm going to go in and I'm going to retract the lip, and I'm going to have her close slightly, and that releases the TMJ, and you're not going to be able to see very well, but I'm going to put my probe as distal as I can. Remember, we wanted to go past the line angles, right? Into what area? The coal. And I am not going to remove my probe from the sulcus area as I walk it. And I'm doing just little millimeter walking steps all the way around, and then I'm going to go into the coal of the mesial here. And I'm going to angle it somewhat so that I can get into the coal, but I don't want to be straight because then I'm only at the line angle. I want to be in here. You see that? So I'm going to have to angle it slightly to get into the coal and then straighten up a little bit. Because if I go here, I've missed all this in here. All right? So I'm going to walk it, and then I'm going to go into the distal of the tooth in front. And this tooth is a implant, so I'm going to skip it. They do have implant probes, which I don't have in my setup, okay? So I would have looked at her record ahead of time and known that she had an implant, and I would have been prepared with some implant instruments. Now, notice I'm going in this way with the probe. You see, I'm going this way, okay? So as I come along, notice how I'm not taking it out, and I'm using very light pressure. And they say about 5 grams. Well, who's going to know how many 5 grams is? You're not. I've got a modified pen grasp and a fulcrum. And I'm as parallel to the long axis of the tooth as I can be. And I am allowing for the height of contour at the cervical third. So you notice I'm not coming in straight like this because then I miss the gingiva. I have to allow for that height of contour.